I'm going to hand it off to this one badass woman again, Miss Elizabeth Moe. Thank you.
Thank you. I have some big news to share. And before I get to the big news, I'm going to just do a few more appreciations, because this magical existence, this magical conference would not have come together without a lot of hard work and a lot of commitment from people and late nights. So I want to thank MDH for sponsoring Dr. Eddie Moore's plenary and for bringing so many people from the Health Promotion and Chronic Disease Division to our meeting. I want to thank, and just to send out a personal thank you to Mary, Katija, and Chuck, and especially Melanie Peterson-Hickey, Jaime Martinez, and Erica Fishman. I feel like I grew up with these folks. I spent 10 years in Mary's office in the HPCD division director's office, and I really appreciate all the work you all did to make this happen. So thank you, genuinely and deeply. And thank you all for being here and hearing the messages. I also want to thank the Region 5 Public Health Training Center's sponsorship of Kenston Henderson's session. That was another really big gift to all of us. And we really want to make sure that everyone knows that that came from Region 5 Public Health Training Center. And I'm going to put the planning committee in the chat. They have worked really hard, and I can't count the number of hours, but you've seen how coordinated they've been and that we have all been. And it's a group that is a pleasure to be part of, and it's been fun. And so when the opportunity comes around next year, please join in. Now for the big news. This is big news. We've been keeping it under our hat. It just came about this past week. But Blue Cross and Blue Shield of Minnesota has made a significant sponsorship to MPHA to advance and operationalize the racial equity in our public health work. I want to praise Blue Cross and Blue Shield of Minnesota, another place where I have had a professional home. And I want to address, to say that I see them exhibiting accountability and partnership to advance and operationalize racial equity work across sectors in public health. I see them in all different sectors. People are local government elected officials. People are working in food, in housing, in physical activity. They're working with making trans health accessible across our systems. So I really am proud that Blue Cross recognized that MPHA is ready to take action, and we just needed that extra bit of funding that will help us get started. So it's a significant gift. It's a sponsorship, and we're hoping that it will fund about 2 years worth of specifically racial equity and health equity policy and advocacy work. And yet stay tuned for more details about how that'll happen. But the work does not stop Friday at noon. The work is going to keep going. And it's an exciting time for MPHA. You know, we've never been more visible than we are in these moments of crisis. And we are going to use this momentum to create change and leverage opportunities to support future leaders of color and to advance our policy and advocacy work. And we want to integrate racial equity into our leadership in MPHA, and we want to support the practices of health equity wherever we can. And we have to speak out. And that's another thing that we want to commit to. We've been really active, especially with the leadership of our health advocacy, our health equity committee, and our policy and advocacy committees at making statements. And now we want to build on that work. And we want to push ourselves to be even more visible and creating the next generation of leaders. And I say in the way that we did for tobacco policy 20 years ago. We have to engage in policy change to see change at the systems level. And it's local public health officials who have been speaking to the science, whether it's around food access, around homelessness, around tobacco, and now around racial equity. So we really want to reach out and support and work with our public health colleagues across sectors to make sure that we all feel like we're ready to speak up and ready to speak to the science. I want to just like a little celebration that MPHA is almost at 500 members. So thank you all for your enthusiasm. We had a great reach. Thank you. I see Delaney dancing in the tech booth. She really brought 5 schools, lots of students. Thank you. Thank you to everyone for renewing your membership. Our meeting evaluation is going to be emailed to you. So please tell us how we did. We want to hear about it. We care. We will take it seriously. We will not take it personally. Tell us how we did. We're gearing up already for next year. And a link will be posted in the chat. And there are several ways that you can get involved. On top of the 21-day challenge, next week, next Friday morning, we're having one of our policy forums. It's Public Health Matters. It's on environmental health. Is there justice for all? It will be facilitated and hosted by Dr. Ed Ellinger, who's a perennial favorite. We love him. And so that's a great opportunity to get involved with MPHA. MPHA is hosting some anti-racism and health equity programming. So we'll follow up the MPHA's 21-day challenge with a couple different sessions we're hoping where we can connect around the work we're doing. We have our annual business meeting and awards ceremony on June 15th. And we ask for anyone who wants to tip us over that 500 number, your membership matters. So please join us as a member. And then deepen the benefits of membership by joining a committee. We'd love to see you. So thank you for being here. Thank you, Dr. Moore, for putting the tough questions in front of us. Thank you. We are ongoing. It's an ongoing work. And thank you to everyone here who made this happen. And let's continue the conversation and continue the action.